So hi everyone. Today we're gonna discuss about immunology, and the very first one is lymphoid structure. So as we talk about the lymphoid systems, that is immune systems organs. The very first one is first degree lymphoid organs consist, that is the bone marrow, immune cell productions, and B cells maturations, thymus, that is T cells maturation. So bone marrow is responsible for B cells productions and maturations. Similarly, T cells productions is from bone marrow, but maturations is from thymus. So the bone marrow and thymus are primary organs. Likewise, talking about secondary organs, that is spleen, lymph nodes, tonsils, Peyer's patches, allow immune cells to interact with antigens. Now talking about the lymph nodes are actually secondary. Here we have already discussed about, that is it is secondary lymphoid organs that has many afferents, and one or more efferents, that is here we have one efferent encapsulated with trabeculae. So here we have capsule of the lymph node which invaginated insides, which is called trabeculae. So again we can read it as lymph nodes are secondary lymphoid organs that has many efferent and one or more efferent encapsulated with trabeculae. Functions are non-specific filtrations by macrophage, circulations of B and T cells, and immune response activations. So lymph nodes are for circulations of B and T cells and immune response activations. Now lymph node consists of three parts, that is cortex, paracortex, and medulla. Here we can see the cortex region. Likewise, here we have paracortex, and then the rest part is medulla. So talking about the cortex part, it consists follicles that is located in outer cortex, site of B cells localizations and proliferations. So follicles that present in the outer cortex are responsible for site for B cells localizations and proliferations. First degree follicles are dense. Here we can see the first degree follicles are dense, and second degree follicles have pale central germinal centers. For second degree follicles. Now talking about paracortex. So paracortex contains T cells. Here we have talked about follicles that it consists of B cells, localizations and proliferations. Likewise, the paracortex contains T cells, region for cortex between follicles and medulla. So paracortex are in between the cortex and medulla. Contains high endothelial venules. Endothelial venules are present in the paracortex, which through which B and T cells enters from blood. Underdeveloped in the patients with digest syndromes. So in the digest syndromes, it is underdeveloped. Paracortex enlarged in extreme cellular immune response, Epstein-Barr virus, and other viral infections. Paracortical hyperplasia is uh, seen in lymphadenopathy, that is lymph swelling. Now talking about the medulla part, innermost, that medulla consists of medullary cords and medullary sinus. So medullary cords are closely packed lymphocytes and plasma cells. Medullary sinus contains reticular cells and macrophage. Medullary sinus communicates with efferent lymphatics. Here is efferent lymphatics. So medullary sinus communicates with efferent lymphatics. So this was for this much for